Velkommen til Uten Filter. Mitt navn er Marlén, og min gjest i dag er dr. Meryl Nass. Hun er spesialist på indremedisin og ekspert på vaksiner og biovåpen. Og som forsker så har hun vært med på å bevise at antrax-epidemien var på grunn av biovåpen, og vittnet 6 ganger i kongressen om antrax-vaksine og biologisk krigføring. Hun har også vært rådgiver på biovåpen til forskjellige tresifra byråer, og blant annet for Director of National Intelligence. Og hun har vært med på å ha fått avslørt de massive forsøkene industrien har brukt på å undertrykke bruken av hydrochloroquine og ivermectin mot covid. Hun er dessverre også en av de legene som mistet lisensen sin for å hjelpe pasientene sine med riktig og tidlig behandling mot covid, noe som farmaindustrien ikke ville skulle komme frem som fungerende medisiner mot covid, fordi hadde det eksistert medisiner mot covid, som det jo gjorde, så hadde de ikke fått gjennom sine emergency-vaksiner. Da hadde det ikke vært noe grunnlag for å få ut på markedet vaksiner som ikke er ferdigtestet eller forsket på. Og de hadde heller ikke tjent alle de pengene de har tjent her til nå. Utenom dette så har hun også vært med å editere 3 av presidentkandidat Robert F. Kennedy Jr. sine siste bøker, som er blant annet The Real Anthony Fauci. Og hun er selv skaperen av Door to Freedom, som er en organisasjon som jobber for å stoppe WHO sitt kupp for å kontrollere verden. Dette intervjuet vil foregå på amerikansk. Ønsker du å se intervjuet med norsk tekst, så kommer det om et par uker. Ellers følg med nå. Del gjerne videoen med dine medmennesker, for dette er viktig informasjon som kommer til å komme frem nå. Da starter vi. Meryl, welcome! I am so excited to have you here on Uten Filter, which would be directly translated without filter. And I just want to say I have so much respect for you because you just, you advocate for truth and you stand up for the people. And I just thank you so much for being on here today with us. Thank you.
Yeah, it's so nice to see you again, Marlén.
Yes, the same. Great to see you again too. So we're here to talk about the WHO Treaty. And can you explain to our viewers in the shorts, what is the WHO Treaty and its connection with the international health regulation and the One Health?
Yes, so allegedly, because the nations of the world did not cooperate well and there was no equity in sharing of vaccines and drugs during COVID, for that alleged reason, the WHO and its nation states and the stakeholders behind the WHO, including the Wellcome Trust, the Rockefeller Foundation, and the Bill and Melinda Gates Foundation, decided that we needed a new pandemic treaty to more fairly share resources during pandemics, and we needed massive amendments to the existing international health regulations for the same purpose. Now, information came out on Friday, a letter from Senator Roger Marshall to the Inspector General of the Defense Department, which revealed that the United States was actually collecting potential pandemic pathogens from over 30 countries. They were being stored at the University of California, Davis, by an associate of Peter Daszak, and the Defense Department was then paying to have them shipped from the University of California to the Defense Department. So essentially, we already had a U.S. biohub collecting pathogens from at least 31 countries. And that program ran from 2014 to 2020, and it stopped suddenly in March of 2020. And in 2021, it looks like the World Health Organization took it over and began developing its own biohub network of laboratories that would collect, store, and study potential pandemic pathogens, which I also refer to as biologic warfare agents. So this biohub system and what the WHO has referred to as the pathogen access and benefit sharing system are critical parts of the pandemic treaty. So although the treaty was said to be about equity for developing nations, it turns out the most important part for the stakeholders and the developed nations that are sponsoring this is actually the collection of a library of pandemic pathogens that will be globally shared. So the DoD program essentially is being transferred to the WHO. This sort of is an entree or an opening to an era of pandemics, so that if every nation has hundreds or thousands of potential pandemic pathogens, and apparently the Defense Department purchased from the University of California over 2,000 samples of viruses and bacteria that could be very dangerous or lethal to humans. The likelihood of accidents, leaks, or deliberate spread of these pathogens becomes a much bigger risk. Other things that are included in the treaty and the amended international health regulations are a requirement that nations perform surveillance of their citizens' social media and then censor it if the citizens are saying anything that disagrees with the WHO health narrative. They are also sort of demanding that nations put in place the laws that would allow nations to roll out unlicensed vaccines. Now, a vaccine is unlicensed, and drugs, because it's unlicensed because it hasn't been tested properly, or perhaps it hasn't been tested at all, or it hasn't been tested in humans. And what the treaty has demanded up until the very last version, and there have been 9 versions, is that countries also put in place a liability shield so that untested, unlicensed drugs and vaccines can be rolled out, and their manufacturers and the governments and the WHO will not be subject to lawsuits. They cannot be. They will be given a liability shield in case people are injured by these vaccines or drugs. In addition, there was the possibility to mandate vaccinations, to close borders, to limit travel, to require vaccinations, to require testing, and to impose lockdowns of various kinds. So there are many provisions in this treaty that actually mimic exactly what went on during COVID. But governments who imposed the restrictions during COVID often did so illegally. What these documents will do is provide a legal framework so that every country, the 196 countries that are part of the international health regulations, will now have a legal excuse for why they need to lock you down, and you can't sue and you can't fight them. So it's very, very disturbing. Clearly, the lockdowns and the other methods that were used during the pandemic did not make things better, they made things worse. And to say that we need a pandemic treaty to make things better the next time, but then actually enforce and legalize all the restrictions that were placed on us last time, is not making things better, but will make things worse. This is also a power grab. So the WHO is actually taking away sovereignty from the nations because it reserves the right to direct nations what laws they must pass and what they must do. And the Director General of the WHO, who is not himself even a physician, would be the person who would unilaterally make the decisions. He could consult with experts if he wishes, but he will make the final determination of what lockdowns, what vaccines, et cetera, will be mandated or will be recommended. And so this is very troubling, because clearly a one-size-fits-all way of conducting public health is never what any public health experts or doctors or patients wanted. What a person in Malawi needs is going to be very different than a person in Boston. And, what an 80 person needs is different than what a 6-month-old needs. So trying to centralize global control of health within the WHO makes no scientific or medical sense. And it's particularly troubling because this has been associated with statements by the World Bank, by the UN, by the European Union, that global health governance is what is desired. And
Yeah, because
that's what we don't desire. Go ahead.
Yeah, exactly. Yeah, because when you said like a global health thing, isn't there like something called One Health that's kind of like a Trojan horse that they gonna use regarding
Yes.
trying to control?
So One Health is a very strange concept that you can no longer think about human health in isolation, but we need to consider the effect on animals, plants, and ecosystems of human health and what we do for human health. It's a concept that doesn't make any sense, and yet many billions of dollars have been spent to embed this idea into agencies around the world. So many universities have One Health divisions. Many, if not most, public health offices around the world have small One Health departments. The CDC has a One Health division. One Health has been embedded in federal law in the United States. It's been put into many agencies. And why would this be? Where is it coming from? Well, it turns out that all sorts of things around the world have been designated as being part of One Health, from government policy to your relationship with your pet, to ecosystem health, biodiversity, species loss, climate change, all sorts of things. And now that you're able to call them all health, you can hand them to the Director General of the WHO to manage. And so that the Director General can now declare a public health emergency based on climate, based on pets, based on plants, based on weather. So this is very troublesome. The Director General has no expertise.
Doesn't he have diplomatic immunity?
Yes, all the WHO officials have diplomatic immunity, which means you can't sue them and you cannot take the WHO to court either. It is not under the jurisdiction of any court. It's only under the jurisdiction of the United Nations, which, as you know, is fairly meaningless. So that whatever the WHO does, nobody who works there will be taken to account for it.
Which is like mind-blowing to me. And the fact that Tedros has the background that he does, supposedly, I don't understand how did he end up, like, I don't know if you know, I don't know how he got that job, but I don't get why he got that job. Definitely don't understand that with that background.
Well, I think he got the job because it was time for an African to be the head of the WHO. I don't think there had been an African before. He was pliable. He had already worked a lot with the Bill and Melinda Gates Foundation and with the Chinese government and Communist Party. And so he was a known quantity. There was an African bloc. So there were 54 African countries that previously voted together, and they would sometimes vote against policies that the developed nations wanted. And so this was a very big bloc, more than 25% of all the countries in the WHO. And they wanted to be able to gain control of the African bloc. Now, when Tedros was first elected, his party was in office in Ethiopia, but subsequently his party was pushed out of office. And initially, the other party said they didn't want him there at the WHO anymore. He was basically an enemy. He had been accused of human rights violations to other tribes in Ethiopia on multiple occasions. But anyway, they backed down. Maybe they were bribed. Who knows? There's a lot of back dealing going on at the WHO and at all these international organizations.
Yeah.
And sure enough, the 54 nation bloc of Africans has started to break down. So now several countries in Africa have left that bloc and joined up with the developed nations to vote with them on these documents. So that was probably why Tedros is there.
Yeah, no, yeah, it's I don't know, something's not right.
He is the first non-physician to run the WHO. But of course,
and
I
so
think what we've learned from COVID is that physicians can't be relied on to do the ethical thing the way we used to think they could.
yeah, and to talk about that, because they managed to take your license for treating your patients the way they should have been treated. And can you tell us a little bit what happened around that?
Yes, well, when COVID came, of course, you know, I have a long history, 35-year history of working part-time in biological warfare, biological defense, and pandemics. And I had been the first person in the world to show that an epidemic was due to biological warfare 32 years ago. So when COVID started, I, of course, was looking into how we were managing it, whether it was going to become a big problem, everything. And I quickly learned by the beginning of March 2020 that hydroxychloroquine was being used in China, along with chloroquine, in 20 clinical trials. And it seemed to be the most effective drug they were using against COVID. And that Raoul Didier, a very famous French infectious disease doctor in Marseille, was using it also and having a great response. So, and by mid-March, the WHO had decided to start testing hydroxychloroquine, even though it wasn't on the original list of substances to test for COVID. So there was good reason to think hydroxychloroquine or chloroquine could be effective against COVID. And I began using it in my patients, and it seemed to be working quite well, as long as you gave it early. It didn't work once the virus had stopped reproducing. Then when ivermectin became known as another very effective agent, I began using that. I also recommended vitamin D and aspirin, vitamin C, and other things to patients. And at the same time, the governments at the state and federal level were trying to suppress the use of these drugs. And when the vaccines came out, I pointed out I am also an expert in the anthrax vaccine. And, you know, I wrote the first review article on anthrax vaccine. I've testified before Congress a couple of times on anthrax vaccine. So I started looking at the vaccine and pointing out the problems or potential problems with it. And by the middle of 2021, a national organization, it's actually an NGO, not a government organization, called the Federation of State Medical Boards, started sending information to all the state medical boards, which are the organizations that license doctors and regulate and help to regulate them. The state regulates doctors. And told them to basically shut down doctors who were using these drugs or saying bad things about the vaccines. And so I received an email from my medical board telling me that, and I challenged them on it. And I said, look, you know, where do you get the authority to tell me what licensed drugs I can and can't use? And what gives you the authority to tell me what I can and can't say outside the office in my private life? And so they didn't like me for asking those questions. And so they went after me. They managed to get to complaints against me for things I was saying on the internet from people that had never met me. And eventually they were able to drum up reports from a doctor and a nurse midwife that I had treated patients that they also were treating with ivermectin or hydroxychloroquine. And the doctor thought that ivermectin was horse paste, didn't realize it was a licensed drug. And the nurse midwife didn't realize that the drug she gave the patient was actually unlicensed, and the drug I gave the patient was licensed. Anyway, so the board went after me, suspended my medical license for this. And the next day it was in the national news. So they chose to use me as a poster child to scare all the other doctors. And subsequently we had a hearing. The evidence in the hearing indicated that I was innocent of all the charges. And then the board voted unanimously that I was guilty of all the charges and continued to suspend my license. And so I'm no longer practicing medicine. I haven't practiced medicine in over 2 years, but I shifted to becoming an activist on the issues of honesty in medicine, the managing of the COVID crisis and the WHO.
And we are so happy that you are out here being a voice for it, because it's needed. So thank you. Yeah, no, it's amazing to me how they've been able to censor the doctors, and you had fact checkers and all kinds of non-doctors controlling the narrative of the medication and the medicine, and it was kind of weird. And yeah, so what do you think? Because what's wrong with the educational system if so many doctors are not able to see that, okay, we know that this medication is working, right? But we're told from our leaders in the industry that we're not allowed to use it. We're supposed to use an experiment, and they just go along with it. Like, is there anything wrong in the educational system? Why has so many doctors just gone along with the narrative? Do you have any idea or any thoughts on that?
Well, I don't know about Norway, but in the United States, what happened is that large corporations have sort of bought up most of the medical practices. So about 80% of doctors work for large organizations. They get paid a salary, and they're not in control of what they do. And if they spoke out or started using drugs that the company didn't want them to use, they would be fired. If they didn't get vaccinated, they would be fired. And some of this was imposed by the US federal government, which basically said, unless every employee in a hospital system is vaccinated, we will not pay you we will not reimburse you for the Medicare patients. So everybody over 65 in your hospital, you won't get paid for. There were other mechanisms by which these things were imposed. So the hospitals basically had to go along, or else they would have gone under. They would have failed. Also, in medicine is a very hierarchical training. You have to obey the doctors above you throughout your training. And the training for a doctor is a minimum of 7 years after high school in the United States. So doctors have learned through that, and often much more. My son, I think the training was about 14 years, because he's a specialist in cardiology. And so you have all of that training, you have your reputation, and if you do the wrong thing and the board takes your medical license, your career is over. You've just invested 7 or 14 years for nothing. You see, and people can't afford that. They have a mortgage and they have a family and they have a reputation to protect. And so they were basically frog marched into going along. The system in the US doesn't really allow people to bucket. In the old days, when I first started in medicine more than 40 years ago, you could criticize, you could argue with people who were above you to an extent. We were all supposed to do the best thing for the patient then, but that's not true anymore. And so you have to do what's best for the finances of the organization. And if you gave a patient remdesivir, for example, the hospital would collect 20% extra on the entire hospital bill for that patient. So doctors were not given the option of whether or not to give remdesivir. The bean counters, the president or the vice president of the hospital, who might be an accountant, would issue these orders, and they would be they had to be carried out or you would lose your job.
Yeah, it's like they weaponized the doctors, and it's is there anything we can do in order to maybe help the ones that have started to see that, going down under COVID was not, they would have liked to do something different if the next time around, if there's a new pandemic or anything like that. Is there anything we could do to help them understand that it's okay? Because
You
I
see,
mean,
it's not okay. They're still going to lose their job if they speak out. Until we change the system, until we gain control of the government and the people who pay the bills, it's going to be even more dangerous for people to speak out. And now, this is
if all
all
doctors did it.
doctors in the United States are they've seen Dr. McCullough, Dr. Corey, Dr. Merrick have all had their board of certification or their licenses threatened. So unless we change the system and get rid of the corruption that has led to this, we can't get the doctors or anyone else, the teachers, the policemen, the judges, we can't get any of them to speak out.
Yeah. If we were able to create a new system or a new World Health Organization or something like that, who would control it and how would it be funded, and how could we see something in the future that can actually work, that can't be corrupted? Do you have any thoughts on that, or is it too big? Because it's big.
Well, I think, what I've learned from delving into this during COVID and subsequently is that the corruption is much deeper than I ever dreamed. And that there are, networks of people that keep the corruption going. So like Jeffrey Epstein, there are, and those networks have been protected by the FBI and the CIA in the United States. So basically, you have to root that out at the source. You have to basically the culture of the CIA and FBI, for example, are such that corruption is now embedded in those agencies and has been for some time. I mean, Whitey Bulger was killing people in Boston 40 years ago, and yet he was an informer to the FBI, and so he was protected. He ran what was called the Irish mob, the Irish mafia in Boston. So J. Edgar Hoover, remember, became the head of the FBI in the 1930s. So we've had this corruption in our top federal law enforcement agencies for at least 90 years. So the entire system has to be turned upside down. We have to make it possible for people to come forward and tell the truth. So what was done in South Africa at the end of apartheid was a Truth and Reconciliation Commission. So if you tell the truth about the corruption you've been involved with and your fellows, you would be pardoned or you would get a light sentence. But you would have to answer questions about it. You have to be completely honest. And that worked. And so we found out a lot about the biological and chemical warfare that was going on in South Africa during apartheid through the Truth and Reconciliation Commission. And if we had something like that in our countries and people were told, we will go easy on you if you tell us what happened and who was involved, we could use that to weed out the bad apples in the agencies and try to rebuild them and make honesty, the sine qua non, and make corruption, the first episode of corruption, you're out. And this will stain your record for the rest of your life. You will never be in law enforcement again, for example, or you will never be in medicine again if you are corrupt. We can stop the drug companies from paying off doctors. We can stop the US government from paying doctors to give people poisons if we get control of the governments, if the people get control. So how do you get control? Well, one way is paper ballots, and you make sure you've got a video camera and you've got people watching the ballot box 24 hours a day until those ballots are counted. You don't do anything electronically. You know, you have to get rid of the technology that can be so easily hacked and go back to basics, fair elections. If we could have fair elections, fair candidates, and if candidates that are corrupt, again, would be prevented from being in the process any time in the future. One episode of corruption and you're out of politics forever. You know, we could solve a lot of problems.
Norway, CEPI has headquarters in Oslo. Most people in Norway haven't heard of CEPI.
Yes.
How is the connection there with Bill Gates and the WHO? And can you?
So Norway has a huge sovereign wealth fund, and the globalists and the criminals all want to get their hands on it. And what's the easiest way to get your hands on it is to pretend you're using the money for some wonderful endeavor that's going to help people around the world, or it's going to help poor Africans. So so Norway donates a lot of money for purposes that are allegedly to help the poor, but in fact to go into the pockets of globalists, and are helping to bring this sort of agenda of centralizing government power into force. So CEPI is called the Coalition for Epidemic Preparedness Innovation, and it was introduced at Davos at the World Economic Forum by Jeremy Farrar and Bill Gates. And Norway was the top funder at that time. The United States is also a big funder. And its goal was to be able to roll out vaccines in 100 days. And so if you go to the website of CEPI, CEPI, you'll find the 100-day plan all over that website. They want to develop vaccines in 100 days. Now, what I have to tell them is it's never been done. It's never been done successfully, and it can't be done now because you cannot test vaccines in animals for safety. You can only test them in humans because humans have completely different side effects than all experimental animals have. Every creature has different side effects from vaccines and drugs than other creatures. And so unless you can give a drug or a vaccine to a human and then watch them for a period of weeks and months, you won't know what the side effects are. All right. So if you're going to develop a vaccine in 100 days and then manufacture it in 30 more days, so you've got enough for the entire population, and then you give it to everybody at once, what have you done? You have made sure you won't know what the side effects are until everybody in your country or everyone in the world has received that drug or vaccine. This is completely the opposite of drug and vaccine development as it has been, used in every country in the world for hundreds of years. What you're supposed to do when you're developing a drug or vaccine is to give it to a very small number of people, often people with cancer or dying, because you don't want to harm healthy people with a potentially dangerous drug or vaccine. So you give it to a small number of people, and if they seem to be okay, then you give it to a larger number. And if they're okay, then you give it to the young, healthy people and watch them for a while and see if they're okay. And this is why it takes 10 to 15 years to develop a drug and a vaccine. And the vast majority of vaccines fail during that process. Either they don't work or they're not safe. So all of it to say that you're going to, we just have this plan, and by the way, Jeremy Farrar is a doctor, although Bill Gates is a college dropout. Farrar also worked closely. His boss at the Wellcome Trust, he was the director of the Wellcome Trust at the time when they rolled this out in 2017, was the head of MI5 in the UK. And I believe that Farrar is actually an agent of the intelligence services of the UK. And he worked closely with Tony Fauci to cover up the origins of COVID. He is also responsible. He supposedly had the idea to do clinical trials of hydroxychloroquine in which 2,600 subjects were overdosed with hydroxychloroquine. And in the UK, where there were 1,600 subjects, more than 400 died during the clinical trial, in part because of the overdose. So Jeremy Farrar is an unethical person who has a college degree. He's also lying constantly about the threat of bird flu, which he says is extremely dangerous and deadly when it's never killed a single American. And in the 20-something year history of bird flu, there's only 400-something people that ever died from it, and that was before it mutated. So now it's mutated into a form that is basically benign for humans. But Jeremy Farrar wants bird flu to be the next disease X and potentially to lock us or our animals or our birds and our cows down. This has already occurred in Michigan, where restrictions have been put on cows because bird flu has been discovered in cows in Michigan. And anyway, Jeremy Farrar and Bill Gates, two people who have a big stake in the pandemic response. Bill Gates stands to make billions of dollars from selling pharmaceuticals and other products. And Jeremy Farrar, as I said, is basically a top-notch intelligence apparatchik who was moved from his very lucrative, he was making almost $1 million a year at the Wellcome Trust, and he's moved to the WHO as its chief scientist, earning about a third of that, so that he can roll out vaccines through the WHO and CEPI. And CEPI has collected billions of dollars of tax dollars from Norwegians, from Americans, and from British and other nations to create this program. And it's possible it is a program to reduce the population. I mean, there's no real reason to say you're going to roll out vaccine. I mean, yes, if it were possible to do it safely, it would be a good idea. It might be a reasonable way to approach a pandemic. But if you can't do it safely, then you have to focus on drugs. And what they did with COVID was to beat down the drugs that actually worked, to make sure that the pandemic persisted. You know, it wasn't solved with the drugs, and persisted until they could get vaccines out, and the vaccines turned out to be very dangerous. So it took over 300 days for Pfizer to get its vaccine authorized during COVID, and they're looking at an authorization, between 100 and 130 days. So we should not go along with this. Norway should absolutely not donate any money at all to this project. This is a terrible project. But of course, having the right people in charge in Norway who will make these wonderful donations to globalist projects is very important to the globalists. So it's super important for the world that Norway has fair, free elections, and that you select people to run your nation who, are not tools of this globalist agenda.
Yeah, that's very important, actually. And I just hope that the Norwegian people know that their taxpayers, or the taxes are being used to fund research, make vaccines, and when those vaccines are sold, the money goes to the big pharma. It's like it's weird. It's like I don't know. I really hope that the Norwegian people really look at the what each politician is standing for and vote in regards to the person, and not the populist vote kind of 1st of June is coming up soon, and it has, I mean, if the treaty goes through, or if it doesn't go through, how do you see us moving forward with either or of the result, and what can we do in order to continue the work to try to spread the knowledge, or to work against all this corruption?
Well, so the WHO the entire membership of the WHO will meet from May 27th to June 1st, and is planning to make a decision on the pandemic treaty the amendments to the international health regulations. The problem is that there is no final version, and it looks like they won't have a final version until the meeting starts, or maybe even after that, which is, by the way, against the rules of the WHO. They need at least 6 weeks for the treaty, and they need at least 4 months review for the amendments. So they're proposing to vote basically illegally on the documents. Whether they will or not, we don't know. If they vote on them and one or both is approved by the membership, then we're looking at trouble going forward. And we're looking at, as I said, some centralization of healthcare and information control within the WHO. But going forward, the UN is seeking the similar powers as the WHO Director General. So the UN has proposed that emergencies are a problem that the UN could be involved with. And the Secretary General of the UN has proposed to the General Assembly, the 193 member nations of the UN, that he be given the power to call global shocks and then issue an emergency platform to deal with the global shocks. And he suggested 7 different potential global shocks. And interestingly, he includes the WHO public health emergencies. He includes biological warfare, and he includes pandemics. So that tells us that the UN was already worried that the WHO might not get these things through. And so plan B was that the UN might be able to take control of pandemics and biowarfare if the WHO couldn't. And similar to the WHO, the Secretary General would be able to declare these global shocks anytime he wanted to. He would be expected to confer with experts, but he would make the decision. And then once he called a global shock, he would be able to direct the world what to do about it. So he's looking for the UN members to give him that authority in September. And what we're going to need to do going forward is to fight that and to point out that this plan is essentially the same plan as the WHO's. This is a globalist plan. It's been developed by the stakeholders behind these 2 institutions, like Bill Gates and Jeremy Farrar and the Wellcome Trust, the Rockefeller Foundation, et cetera. George Soros, who really want to centralize power globally and have decided that these international organizations are the easiest way to do it.
Yeah. No, it's it's not. How do we move forward in stopping this? It's like, how do you find the strength to keep fighting this corruption and evil day after day? What do you?
Well,
what
the
do you
thing
find?
is, there's not that many globalists, and there's 8 billion of us. And the globalist plan completely relies on deceit and doing things that nobody knows about. So they right now control the media, and the media has not covered any of this. If you were reading the mainstream media, you would not know that these meetings are coming up and this is what is going to be discussed. And you would know absolutely nothing except possibly lies about the WHO pandemic treaty and the international health regulation amendments. And Tedros himself has just recited a litany of lies about them. You have to read the documents and then you find out what's in them. And I've made screenshots of many of the bad parts of them. So people who don't have time to read 90 pages of legal jargon can just look at a screenshot and see what they're actually doing. Once people find out what's going on, nobody likes it because it's not in anyone's benefit. The nations are not advantaged. There's nothing really in there about improving the conduct of pandemic management. There's just this, One Health, a big pandemic biohub collection of thousands of biological warfare agents to be shared around the world. Taking away liability for inadequately tested or untested drugs and vaccines. Why are any of those things a good thing? They're not.
They're not.
I feel very confident that when people realize what's going on, not only will they not want it, but they'll be very, very angry at how they've been fooled. And so I feel confident that we will win, but the way we win, because we don't control the media, even the social media are being controlled. We have to tell our friends and family, one person to one person, what's going on. And we have to protect ourselves so you don't take the next vaccine that hasn't been tested, right? You make sure that you've got an honest doctor. Hopefully you can find one. You don't believe the narratives that are being put forth, by our governments when it seems like they're more interested in controlling us and what's the word? Making us poor than anything else. They're interested, there's been a tremendous shift to billionaires, a shift of money during COVID. Trillions of dollars were shifted upwards from the working class and the middle class to the trillionaires. And what these plans for pandemic management will do is cause more of that shift. So once people realize that, it's pretty clear that we shouldn't go along.
Yeah, we saw a lot of smaller businesses go bankrupt during the lockdowns. So it had a huge economically impact here in this country, which is really sad. It's not good.
It's horrible. We had about 1 million small businesses go under in the U.S.
Wow. Yeah, that's so bad. Yeah. What question haven't I asked you today that you wished I had asked you? Have we missed something important of a topic?
No, I think you've asked all the good questions.
I did? Oh, well, that's good. Because
no, I think
back to, huh?
No, I think we've covered everything important.
Okay, good. Yeah, because going back to the thing that mainstream media is not talking about certain things, that's why we started Mistet without filter, because we saw that it really needs to be brought forward the right information so that people can get informed and not just have one narrative. Because before in mainstream it used to be different sides. There were an honest debate, and it's gone. It's
yes.
It doesn't survive.
Right.
Yeah. So thank you so much for coming on here, Meryl. I am so excited to see you once again, and hopefully we can have you on sometime in the future again if you'd like to. And thank you for all the amazing information. I hope our listeners and viewers really learned something today. So thank you so much.
Well, thanks for giving me the opportunity to talk to Norway again. And I think, Norwegians are smart. I think they should be able to figure this out pretty easily. And let's hope they can help make the changes that we need in the world. Thanks.
Yeah.
Thanks very much, Marlén.
And thank you so much for all the work that you do. The world needs you. So thank you.